I was browsing the PubMed medical library and doing some research about breast cancer, learning about the nuances of its development and treatments. During my research, I came across a comprehensive review article titled, Breast Cancer, Epidemiology, Risk Factors, Classification, Prognostic Markers, and Current Treatment Strategies. An updated review, by Sergiusz Łukasiewicz and colleagues, published in the journal Cancers in 2021. I found this article to be an invaluable resource, and I decided to create a video to share the key points and insights from this research. You can find a link to the full article in the video description below. Breast cancer is the most frequently diagnosed cancer in women worldwide, with over 2 million new cases in 2020. As the incidence and mortality rates continue to rise, it is crucial to stay updated on the latest research and advancements in breast cancer management. This extensive review summarizes the current knowledge on breast cancer epidemiology, risk factors, classification systems, prognostic biomarkers, and available treatment strategies. The authors highlight the importance of understanding both modifiable and non-modifiable risk factors in developing effective prevention strategies to reduce breast cancer incidence. They also discuss the various molecular subtypes of breast cancer, based on mRNA gene expression levels, which have significant implications for prognosis and treatment decision-making. Furthermore, the article explores the utility of several prognostic biomarkers, such as estrogen receptor, progesterone receptor, HER2, Ki67, and circulating circular RNA, in predicting patient outcomes and guiding treatment choices. The authors also provide an overview of the current treatment modalities, including surgery, chemotherapy, radiation therapy, endocrine therapy, and targeted biological therapies, emphasizing the importance of a personalized approach based on the tumor characteristics and molecular subtype. In conclusion, this comprehensive review by Łukasiewicz et al. Serves as an invaluable resource for healthcare professionals and researchers seeking to stay informed about the latest advancements in breast cancer management. By providing an updated overview of the epidemiology, risk factors, classification, prognostic markers, and treatment strategies, this article contributes significantly to the ongoing efforts to improve outcomes and quality of life for breast cancer patients worldwide. Part 1: Understanding Breast Cancer, Epidemiology and Risk Factors. Welcome to our deep dive into one of the most common and impactful diseases affecting women worldwide, breast cancer. This video, part 1 of 2, will explore the latest findings on breast cancer's epidemiology, risk factors, and how these elements influence current treatment strategies. Breast cancer overview. Breast cancer is the most frequently diagnosed cancer among women globally, impacting millions each year. Despite advances in treatment and detection, the prevalence and mortality rates of breast cancer continue to rise, making it a crucial area of study and awareness. Epidemiology. In 2020 alone, over 2 million new cases were reported. The last statistics in 2023 are even higher. I could not find the 2024 report, but I will update the statistics in the next video. The disease predominantly affects women over 50, though it can occur at any age. Developed regions report higher diagnosis rates, attributed to better screening and detection methods, yet, the mortality rates are disproportionately higher in lower-income countries due to lack of early detection and treatment options. Risk factors. Understanding risk factors is key in prevention and treatment. These factors are categorized into modifiable and non-modifiable. Non-modifiable factors. These include age, genetic predisposition, like BRCA1/2 mutations, and family history. Interestingly, less than 1% of all cases occur in men, but they tend to be more aggressive when diagnosed. Modifiable factors. These include lifestyle choices such as physical activity, diet, alcohol consumption, and hormonal replacement therapies. Each of these factors can significantly alter the risk of developing breast cancer. Conclusion. This section has set the stage by outlining how widespread breast cancer is and what factors contribute to its development. Stay tuned for Part 2, where we'll dive deeper into the classification, diagnosis, and advanced treatment strategies that are shaping the future of breast cancer management. Don't forget to subscribe and turn on notifications so you won't miss the next installment in this crucial discussion about breast cancer. Part 2, Advanced Insights into Breast Cancer. Classification, Treatment, and Biomarkers. Welcome back to our detailed exploration of breast cancer. In this second installment, we dive into the classifications of breast cancer, the cutting-edge treatment strategies, and the vital role of prognostic biomarkers in enhancing patient outcomes. Breast cancer classification. Breast cancer is not a single disease, but a group of diseases with varied behaviors and treatments. The classification is based on the molecular profile of the cancer cells, luminal A and B, hormone receptor positive, lower and higher grade, respectively, with different prognosis and treatment approaches. HER2 enriched, characterized by high expression of HER2 gene, aggressive behavior but responsive to new targeted therapies. Triple negative, Basel-like, lacks estrogen, progesterone, and HER2 receptors, typically more aggressive with fewer treatment options. Claudin low, features high levels of tumor-infiltrating lymphocytes and is associated with poor outcomes. Treatment strategies. The treatment of breast cancer is multifaceted, incorporating a range of strategies to target the disease at various stages. Here's a deeper look into each. 1. Surgery and radiation. Surgery. Depending on the type and stage of breast cancer, options include breast-conserving surgery, BCS, or mastectomy. BCS, also known as lumpectomy, aims to remove the tumor while preserving as much healthy breast tissue as possible. Mastectomy involves the removal of one or both breasts and is typically recommended for extensive cancer or high risk of recurrence. The success of surgery largely depends on the cancer stage at diagnosis, with early-stage cancers having better outcomes. Radiation therapy often follows surgery to destroy any remaining cancer cells. Radiation can reduce the risk of recurrence by 50–65%, depending on the cancer type and stage. Techniques include external beam radiation and brachytherapy, where radiation is delivered inside the breast close to the cancer site. 2. Chemotherapy, used for both curative and palliative purposes, depending on the stage of the disease. Chemotherapy drugs target fast-growing cancer cells but can also affect normal cells, leading to side effects. Success rates vary widely, but neoadjuvant chemotherapy, given before surgery, can increase the likelihood of successful breast conservation. Adjuvant chemotherapy, after surgery, can reduce the risk of distant cancer recurrence. 3. Hormonal therapy, essential for tumors that express hormone receptors, hour+. Drugs like tamoxifen or aromatase inhibitors, letrozole, and anastrozole, block estrogen receptors or reduce estrogen production, respectively. Hormonal therapy is typically used for 5–10 years and can reduce the risk of recurrence by about 40%. It's particularly effective in preventing late recurrences. 4. Targeted therapy focuses on specific characteristics of cancer cells, like the HER2 protein. Trastuzumab focuses on specific characteristics of cancer cells, like the HER2 protein. Trastuzumab, Herceptin, and pertuzumab are monoclonal antibodies that target HER2-positive cancers, improving survival rates significantly. Since the introduction of these drugs, the 5-year survival rate for HER2-positive breast cancer patients has improved from about 75% to 90%. Immunotherapy and emerging treatments. Immunotherapy uses the body's immune system to fight cancer, with drugs like pembrolizumab, Keytruda, now being used for certain cases of triple-negative breast cancer, which are particularly aggressive and difficult to treat. The success of immunotherapy can vary significantly but offers a crucial option for cancers that do not respond to other treatments. Emerging treatments include PARP inhibitors for patients with BRCA mutations and CDK4/6 inhibitors that help slow down cell division in HR+ breast cancer. Ongoing clinical trials continue to explore these and other innovative strategies to enhance efficacy and reduce side effects. Each treatment is tailored to the individual's specific cancer type, stage, and genetic profile, significantly improving outcomes and quality of life for many patients. This personalized approach to breast cancer treatment represents a significant advance in the ongoing battle against this complex disease. Thank you for watching our video series on breast cancer. If you found this information helpful, please subscribe to our channel. Your support helps us continue creating informative and valuable content like this. Don't miss out on our upcoming videos, subscribe now and stay informed about important health topics.